Hey everybody, welcome to Intellectual Medicine. Thanks for tuning us in. It's a beautiful day out there. I hope you guys are enjoying your good health, which begs the question, what is health? So we're going to be reflecting upon that in the first quarter of the hour, and we're going to be bringing you exciting news in regard to hormone therapy, reassuring people that it is safe and it is a powerful means of avoiding the consequences of aging. That's our opinion. We'll be talking about that. Let's see if we can do this down. All right, and away we go.
The following program has been paid for by Dr. Stephen Petteruti. It is for entertainment and basic informational purposes only, and is solely responsible for its content. It does not reflect the views of Cumulus Media, WPRO, its management, or its staff. News Talk 630 and 99.7 FM, WPRO presents Intellectual Medicine with Dr. Petteruti. Join Dr. Petteruti as he guides people towards living the 120 lifespan while retaining youth. He'll apply logic, reason, and scientific evidence to address conditions that drain people of their joy and vitality while protecting people from the harmful aspects of conventional medicine. Now, here's Dr. Steve Petteruti.
Good morning, everybody. This is Intellectual Medicine. I'm Dr. Steve Petteruti here on WPRO, your intellectual voice of Southern New England, checking in along with Shannon. This morning, we're going to tell you, I will give you some news about non-drug ways to reduce your anxiety. This is a plague upon Western civilization. What can you do besides, well, take pharmacology? Maybe a walk in the woods would be good for you. And headline, people, estrogen does not cause breast cancer. There's not an increased risk of breast cancer by virtue of using estrogen. We need to peel that back. Shannon, we need to explore that in great detail. I mean, how often are we confronted with patients whose other doctors are horrified when they find out that we've put them on bioidentical hormones? It's a common phenomenon. A typical scenario, patient comes to see us and we're being restorative to their youthful energy, and they encounter doctors that are of a different philosophical orientation or that lack of fundamental knowledge that we happen to possess and that our patients possess. And I think that's the driving force. You know, it's not as if we're driving around in a van jamming people with hormones against their will. Well, maybe not a bad idea, Shan. I mean, I could see us driving around with like a blow dart, you know, like you
I could see her like squirting people with it.
yeah, right. You know, you see somebody like really miserable, grumbly, you know, decrepit. Bang! You just hit him with a testosterone dart from 100 yards away.
Gun, right?
You know,
we do that.
Hey, we should be careful though. We may be giving the state some ideas. Can't you see them now? Picture them driving down the street with a health van. And after all, you know, we're doing this for the good health of the people. And you know what a lot of people don't do, Shannon? They don't follow the instructions from the state very effectively. They're not getting their shots the way they... So now you could drive by with a smart gun and just boom, boom, boom at bus stops. Whack, 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 hitting them with immunizations. What was that sting? I don't know, but it's good for you. Shut up. Here's another one. Boom. Here's another one. Boom. What do you think, Ty, huh? It'd be the immunization police, and they just drive around with a gun. No. We're the shield, brother. We are the shield. I have no gun. Listen, we are not anti-vaxxers here at Intellectual Medicine, but we must curve this conversation to ask that existential question, what is health? Everybody jabbers about healthcare. You know, we're going to make sure you have good healthcare, good healthcare, good healthcare. We're the insurance company. We're the state. We're the Department of Health. We're your doctor. We're your nurse. We are your advocacy group. Well, there's one place and only one person that defines good health, and that's you. Right? Good health to one person is an unwelcomed intrusion to another. If I said to you, is good health living a long life? Some people would say, nah, not really. Not really. I value my freedom of choice. I value my energy. I value being fit and strong. Somebody else might say, I value eating abundantly. I value sitting on the couch and watching TV. My idea of good health is channel surfing and gaming. Now, it's not my definition, but health goes way beyond the absence of disease. Can we get off of that rubric that health equals the absence of disease? It is crude and limited. So now we have the data regarding longevity. And I will preface this, Shannon, by saying I don't care about statistical longevity. I'm not a statistic. I'm an individual, as are all of our listeners. Now, do you value a long lifespan? Shannon, how about you? If you had to rate health, would longevity be a top consideration for you?
Yeah, it would. If you were, feeling good, right?
Okay, is there any point at which longevity becomes no longer desirable?
I think for people, if they get worried about money, if they get worried about, where they're going to live.
So just,
Yeah.
like am I going to outlive my money?
Basics, right.
So here's a tip. The one way to not outlive your money, don't stop earning it. It's like, well, if you don't have this is the thing drives me nuts. Hey Tyler, how much money do you have saved up for your retirement, brother? Do you have that 401k cooking right now? Oh, nice job. Look at him go. Yeah, when I was your age, I had zero. I think I'm still approaching zero. But so my retirement plan, by the way, and this is fail safe. I guarantee this retirement plan. My retirement plan is to die. It's like I will one day no longer get up, and when that occurs, I will have retired. In the meantime, I'll continue to earn. So we started out this ramble talking about longevity and whether or not you value it. Only you can make that decision. But most people, I would venture to say, value independent living. So I was listening and reading about the adjustments that are being made in the social infrastructure for the purpose of supporting an aging population. Think about that. You have a presumption that by virtue of aging, you're going to become disabled and less functionally capable. That presumption may prove to be false or may be self-fulfilling. If we presume that the best we can do for your aging is to give you a walker, is to give you a little zoomy thing to go up your stairs because you can no longer navigate them because your legs are too weak, is to give you special bus passes so that you can transport yourself about. If that's what we presume, and we all expect that to be the outcome, then we're not going to be able to peel ourselves away from the pack. Now, you must maintain musculoskeletal integrity. What does that mean? If your muscles shrink, you're doomed. And unless those muscles are being analyzed, you have no way to know. And how do you analyze them? Well, one way is by body analysis. Another way, how are you doing in the gym? Is your power still there? We know by virtue of looking at humans, they tend to shrink as they age. Why? Why do we accept that as the norm? So I had a patient who said to me, and by the way, in our world, you don't get to preface a status about your health with this phrase, for my age, ... right? No, for my age, nothing. I was talking to an elderly gentleman the other day, now in his mid-80s, embracing a youthful lifestyle. I said, how do you feel? He said, like I did when I was 40. That's the answer. It's not comparing yourself to other people. Look, if you're on the Titanic and you're looking around and saying, I'm not that wet compared to everybody else on the boat, you're still going down. That's not the answer. So yes to your hormone. What do hormones do for you? Well, they're not everything with regard to anti-aging and youth extension, but without them, you will accelerate your rate of decay. Now, what's the barrier? Think about this. What's the barrier? Oh, I'm afraid. What are people afraid of? Cancer. I'm going to get breast cancer. I'm going to get prostate cancer. Well, from the journal Menopause, the headline states, estrogen is not associated with an increased risk of breast cancer. This is from the Women's Health Initiative. They looked at 26,000 women who'd had hysterectomies, and therefore they were on only estrogen. After 8.2 years of follow-up with oral horse urine estrogen, which, by the way, we no longer use in advanced intellectual medicine because, well, who wants horse urine in them? Furthermore, it's a molecular altered form of estrogen that is alien to your body. Bioidentical means identical molecular structure. Now, when we come back, we're going to tell you about the conclusions and why you can be more comforted knowing that your hormones are doing you more benefit than harm. We're going to talk about men's health as well, Shannon, and why women need testosterone. But we'll jump back on this when we come back. This is Intellectual Medicine. I am Dr. Petteruti. So, can we say the jury's in, and can we say that hormones, the benefit to risk is overwhelmingly in favor of the benefit. If you're not on hormone, the only question is, when should you start them, and not if. And a lot of people say to me, well, if I start these hormones, how long should I be on them? And the answer is forever, right? Because your gonads aren't coming back, folks. You're not going to grow new ovaries. You're not going to grow new testicles, right? That arc is predetermined. And when you're done reproducing, biologically speaking, your purpose on Earth is pretty well complete. That is, if you're an orangutan. If you're a human being, you still got a lot to contribute, right? We do more than procreate and die. The longer you can live, the greater impact you can have on the world. Longevity equates to effect in many cases. Look, you could be a moron for 120 years and do nothing with it. I get it. But we're talking to the people who want to live vitally, who want to contribute to others. And I've heard people in my weight loss group and in our hormone therapy say, you know what? It's about time I did something for me. Okay. In reality, when you pursue the anti-aging lifestyle, you're doing something for the people who love you. You know what's crushing folks out there? Elderly, disabled parents. They are crushing people because, God bless them, they're living longer, but they're not living healthier. The anti-aging lifestyle is a wave that began after most of them. Now I'm talking to you, the gang over 70, over 80, over 90. It's never too late. Disability and frailty are a profound disease state that is a prelude to death. If you fall, like think about it, when's the last time you fell? Pause and ask yourself, when's the last time you just flat out, I'm not talking about somebody knocking you down playing sports. I mean, you just fell. I can't remember, Shannon. Okay, when I was hiking Mount Adams with my son, I fell about 82 times. That doesn't count. That's not a prelude to death. I had a 50-pound pack on and it was raining out. Really? And those rocks were very uneven. It's not fair. I think we should pave the mountain. Anyhow, back to the issue at hand. If you fall, warning, that's a prelude to death. It's a marker of infirmity. So when we have power in our legs, in our hip flexors, we're able to adapt to sudden changes in uneven terrain. So I'll hear somebody come into me and they'll say, you know, I tripped and fell. There was a crack in the sidewalk and that's what made me fall. It wasn't the crack in the sidewalk, folks. It was the lack of your capacity to adapt to the sudden change in terrain. So what helps that? Well, power, strength, hormones, and exercise. We'll look at the studies in that.
Joe, excuse me.
Yeah.
Joe asked, how important is B1 compared to B12?
How important is B1 compared to B12? I would say that B12 is the most common B vitamin to be deficient in people. It's the only B vitamin that requires active transportation to get through the gut wall. So we see more need for B12 supplementation. The B vitamins tend to work in concert, so it's hard to discriminate one being superior to the other. But B1 is essential, and typically it's an easier one to absorb from the gut. So a high quality multivitamin usually has adequate amounts. Can always do them IV.
Now back to intellectual medicine.
B vitamins.
We have it.
At 438-WPRO or 1-800-321-WPRO.
We are back. It's Dr. Petteruti. This is Intellectual Medicine. Enjoying a beautiful Saturday morning. So people are complaining about the Red Sox having to play so late. You know, this is now we're heading to the World Series. Yes, you'll get my predictions. So I had my cousin Dave Jose, who had a good take on that, Shannon. He said, really, people? You're going to the World Series and you're complaining that you have to stay awake late? I get it. You know, it's not ideal. But do you think the people in Oakland or St. Louis would be liking to have this problem? I mean, no, they could have been nice and early. You know why? Because their teams are terrible and they're out of the playoffs. So the Red Sox are a historically great team that are going to crush their National League opponents. It'll be like 4-1. It's going to be quick and painless for the opposition. I don't see either one, Los Angeles or Milwaukee, having a shot. I am rooting for Milwaukee, though. You know why, Tyler? You know why I root? because they're Milwaukee. What's it got going for it? If LA loses this playoff series, everybody in Los Angeles will just go to the next thing. What are they going to do in Milwaukee? What do you do in Milwaukee on a cold November night? I don't know. No, that's good. That's the van we want. We want that van to go worldwide. It's a worldwide. We're gonna make it compulsory. You know how? Well, because we got to get back to what we said we would, which is so that's a good idea though, Tyler. I think we should make hormones mandatory. That is, we should go to the senior centers and everybody at age 50, you're required. Think about it. They do it with immunizations. They know it's good for your health, or so they say. Mm-hmm. Why not? Free hormones for everybody. Okay, so why not? Why everybody needs to be on hormones? Look, you have two choices in life when it comes to hormones. You will either go on hormone therapy, or you will suffer the consequence of their absence. Now, the consequence of their absence is commonly perceived as normal aging. Normal by whose standard? Who's defining health for you? Are you defining it for yourself? Okay, so here's part of my definition. The absence of shrinking. I like not shrinking. Preservation of muscle mass. I like not having my muscles disappear. Preservation of bone. You take away hormones, bones shrink, muscles shrink, the brain atrophies, genitals shrink, mental clarity shrinks, mood decreases, irritability increases. These are all known consequences of what is known as the perimenopause. And perimenopause, the window of time during which a woman ceases to be reproductive, can often start as early as mid-30s and even earlier than that, with loss of testosterone and an adverse effect from that. In men, it's sometimes referred to as the andropause, tends to occur a little bit later, but they also perceive that effect of decreasing testosterone, right? Increasing percent body fat. Typical scenario, you go to the doctor, I'm feeling tired, I've lost my sex drive, my strength and power are diminishing, I'm finding myself to be irritable, short-tempered. I've read about, doctor, hormone replacement and low testosterone syndrome, and I'm wondering if I have that. Most doctors do the blood test, tell you your levels are normal, and it's not a consequence of hormones. Go back to your life. This, you're told, is normal aging. Now, we beg to differ. And we're supported in large measure by a growing consensus amongst anti-aging and hormone specialists, people like me, people like Shannon, people like Dr. Michael Souza, that make it their business to study this in depth. So the consequence, by the way, of introducing new knowledge into the field of medicine is instant negative feedback on the part of most of your colleagues. There's a standard of care that exists out there that goes something like this. If I haven't heard about it, it must not be any good, and therefore it must be bad, so I'm going to reject it before I even consider it. Some of you experience this phenomenon. If you go to your doctor, you've done some research, and you say, gee, doc, I've been reading about testosterone. Right away, some doctors, not all, some doctors are very engaged, open-minded. Dare I say, they have the spirit of intellectual medicine running through their veins, and they engage you on your research. And you can do this research, you just got to Google it. Very cool. Anybody now has a medical library in their computer. So the hormone therapy, the big knock on it has been the Women's Health Initiative that correlated with an increased breast cancer risk. This was from the 1990s. Further study and reflection now has revealed that estrogen does not cause breast cancer. There's a trend toward decreasing cancer with non-oral routes of administration. So we start to analyze this data further, and we're seeing the type of estrogen, the type of hormone replacement matters. You don't want to put artificial hormones in your body if it can be avoided. You want things that have an identical molecular structure to what your body has always had. And you don't want to just use estrogen. You do want bioidentical testosterone, especially if you're a woman. So I had a woman who was on her testosterone therapy, Shannon, feeling great, energy's great, power's great, everything's great. She goes to her doctor, who just is horrified and told her, you must stop that instantly. You're going to grow a beard, your voice will get deep, and it's going to give you cancer. Wrong, wrong, and wrong. Properly dosed, There's no masculinization from testosterone. It preserves your feminine attributes. And properly dosed, there's zero evidence of an increased cancer risk of any sort. There is some evidence that there may be a cancer protective merit. That's an unproven theory, but the clinical evidence points in that direction, as does the research-based outcomes. So for women, please lay down your fear factor and look at this with a rational eye. I get that other question, how long should I be on my hormone? And the answer, until they close the lid on your casket. There's no reason nor benefit from stopping hormone therapy at any point in time, in my opinion, and the research will support that. Their current standard of care in the orthodox medical world, which, by the way, we do not concur with, is that you only use estrogen for a brief period of time to get you through your menopause, your hot flashes, then you stop it. Why? Why would you deprive women of this benefit? Why? So they can become aged, so they can wither. So I heard someone say the other day, and I heard this cliche, men age like wine, women age like milk. That's unfair categorization. That is a consequence of absent hormones. You look at the difference now, and we see them every day, the difference between people practicing active anti-aging therapies and those who are not. It is your choice. It doesn't make someone better because they define health as preservation of youthful attributes. But in today's culture, in today's medical environment, at least in the moment, you still have that choice. Why do you have that choice? Because some courageous doctors, and we count ourselves among them, along with Dr. Souza, Shannon, along with you. There's some courageous healthcare providers that are willing to give this to you despite the risk to their professional status. Because when you do things that are not part of the orthodoxy, they're not part of the mainstream, you risk repercussion, negative repercussion. It's called consensus medicine. And what does consensus medicine mean? We're all doing things the same. If we're all doing it the same, then we must all be correct. And if somebody is doing things differently, think intellectual medicine, the consensus would be that they have to be wrong. After all, if intellectual medicine is correct in their theories and philosophy, then the consensus must be flawed. And we feel the consensus in many cases is flawed and deserves criticism and needs to be scrutinized. And you, dear listeners, need to have those options. And you're not going to get them by going to the usual sources. Healthcare is not dispensed at hospitals. It's not dispensed at most clinics. It is not a commodity bestowed upon you by your insurance company. That is sick care. Healthcare you define and you embrace. So yes to your hormones. Now, how about the men? The Prague Conference, International Expert Consensus, said, quote, there is no threshold for testosterone that defines the potential benefit of testosterone enhancement. Translated, you can't tell from a blood test, people. If you're within the normal range, it doesn't mean a whole lot if you have the symptoms to support a benefit from testosterone. Another consensus statement, no basis for age-specific recommendations. You can't look at that level and say, well, you're normal for a 59-year-old. No, erase that. If you're having symptoms, consider treatment. Finally, perhaps most importantly, no evidence of cardiovascular or prostate risk. That is, no increased risk of cancer or heart disease when you go on your testosterone therapy. So why would you totter about with fading testosterone levels when the bulk of evidence is pointing toward benefit? I don't know. Well, because your philosophy tells you that your health is defined differently. Well, when we come back, we need to warn you about a couple of drugs that can cause you harm. But first, from the Revolution Softwash News Center, it's Doug Lizette.
President Trump is beating the drum for immigration
Yeah, so
policy changes as
it's okay, really. It's okay. It's okay to be, it's okay if you choose to be heavy, slow, weak, and withered. Becomes your prerogative because you decided, for whatever reason, that your health is not defined by the commodities of strength, vitality, leanness, and clear mental function. perhaps your definition of health has other more existential attributes woven into it. And I support the ability of people to make those choices. I do not like centralized healthcare decision making. It is impossible in a country of over 300 million people to have a flat line of health and distribute it to everybody. But that's what the authorities want. They want a flat line of health to distribute to everybody. So I don't care that the United States is not number one in the world in longevity, because it's an individual outcome. It's not a societal one. Looking at those numbers can be misleading. It then gives fuel to the argument that we need to do something on a societal level to make everybody's health better, as defined by just merely living longer. The death rate from drug overdose is an American tragedy, and we need to do things to try to intervene. But it doesn't affect my potential for longevity. So to the extent that it weakens the statistical outcome, it has no bearing on me. The death rate from tobacco abuse is the wrong word. Anybody uses tobacco, you put yourself at risk depending on the amount used. Kids nowadays using Juul, they're becoming addicted to nicotine. It's going to harm their health. It's just a matter of time. You know, the problem with the kids in Juul is that they don't have the capacity to make rational decisions about how they value health completely. That's why we limit their exposure, or you try to. But anyhow, so my prediction, Patriots this weekend, they're going to Chicago. I see victory for the Patriots. Chicago does not have an offense with enough diversity to keep pace with our ability to score. Khalil Mack, their great linebacker, is gimpy. He's got a bad ankle. And, you know, Chicago's going to lose. It's going to be a 10-point Patriot victory. We're kind of hitting our stride right now. I already told you about the Red Sox. They're going to sweep to victory. I don't know. Maybe we should put some money on that, Shan, you know? It's illegal to bet in Rhode Island. Can we do that?
Whatever.
Whatever.
Might as well.
Can we?
Right?
Can we? Is it legal to bet? Well, here's what you don't want to do. You don't want to combine cannabis and betting, because it'll cloud your judgment. Oh boy. So we talked about estrogen. I think that message needs to continue to be amplified, people. We're up against so much noise that describes hormones as being bad for your health. I don't know why people don't wake up. And by people, I'm talking about a majority of my colleagues. I don't know why they are not embracing this. It's fear of negative repercussion. If you're an average doc and you're stuck in a clinic somewhere working for the man, your actions are being recorded. Your conversations are being noted. And if the conversations deviate from the orthodoxy, you will be harmed. They will signal you out for repercussion.
Kevin was a little late. He said another sweep for the Sox.
A sweep for the Sox. Yeah, Kev, I don't think they're sweeping. I just don't. This is not the Red Sox with stud pitching at the top of the rotation. I mean, Cora's done a brilliant job with his team. But really, if Benintendi doesn't make that catch, who knows what happens, right? That diving. Did you see that catch, Shannon?
I didn't.
Brilliant, right? Bases loaded, 2 outs, bottom of the ninth. Sox clinging to a lead. Benintendi makes a headlong dive for a catch that ends the game. He misses that ball, it goes to the wall, and we lose the game. So, you know, that's a little bit of luck. I don't see us with a domination to sweep. It could 4-1, 4-2. It's going to be in that neighborhood. And, you know, you got poor Chris Sale. He needs to come see us. He needs some IV. Chris Sale, I'm offering you a free IV. The poor guy.
Some hormones. Get some muscle on that kid.
Well, you can't give him hormones until he retires from baseball.
I know.
We could absolutely give the dude some IV to
who just
energize him.
You can't. Edelman. Wasn't Edelman doing an IV?
No. 1 minute. No, it wasn't. It was a swimmer who was getting an IV at a drip bar.
That's right.
And you can't, according to their rules, get any IV outside of a hospital.
That's right.
Which is absurd, right? The guy's getting IV vitamins, and they suspend him. Well, he just didn't know the rules. The rule is stupid, but it's still the rule. It's like, it makes no sense. It's just our policy. I wonder if they do IVs in the NFL, like at halftime, if guys are dehydrated and stuff.
I think so.
How about if at halftime instead of doing a fluid, you do like a power pack?
That's what I'm saying.
Huh?
Right?
I think that'd be cool.
Me too.
Mm-hmm.
10 seconds. What do you want to talk about next, Shan? Prod conference, you talked about that.
Now, back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
All right, people, we are back. Today's theme really has been how to define health. Is it the mere absence of disease? Is it the presence of youthful vitality? We talked about the benefits of hormone therapy. We talked about the evidence supporting no increased risk for women on estrogen, no increased risk for men on testosterone. We expanded our philosophy and our definition of health, which is simply the delay of physiologic aging. Hey, Shan, did you know that we have an IV that literally will make you younger?
It turns back time.
Turns back time. We're kidding, people. You get this drip, right, and you wake up and it's like Back to the Future. You look in the mirror and you're like 12 again. No, we're kidding. Look, our drips are intended to support youthful health and vitality. The drip bar at Intellectual Medicine has a range of IV support intended for different aspects of your health. Nutrition is widely viewed as the cornerstone of your health, and I think that's an absolute truth. Without healthy nutrition, in fact, there are 5 things, Shannon, that have been demonstrated to add up to 10 years, 12 years for men, 14 years for women if you do these 5 things. Now, why do women get 2 more years? That's not right. And why do you girls keep outliving us? That's not fair. I think that we need a men's health initiative to try to equalize lifespan, because inequality is bad. Isn't that the mantra now in America? Inequality is bad.
Are you offended now?
I'm offended that we die younger. I think we should all die the same. And I think this whole gender thing, we should just move toward like one gender. Everybody should have neutral gender. We should be hermaphrodites. Then we wouldn't have any more issues. Have no worry about bathrooms, right? You go wherever you want. You don't have to worry about what line to get in. Are you going to get a pink thing or a blue thing, right? The good old days when pink was for girls and blue was for boys. What's the new color? Purple, yellow. What do we got? I mean, you used to own Balani, Shannon. This was your field of specialty, right? The newborn mothers and children, and you got to like get things that are, well,
we did a lot of black and white.
What state now enables you to have an undeclared gender on your birth certificate? It's got to be California. I don't know for sure, but I read this. Really, you're looking at me surprised.
What?
Yes, you can have undeclared for your child's gender. Well,
Talk about confusing. Like, these kids don't have enough going on.
Well, aren't there some parents that are raising their children undeclared?
They are. They're going to let them grow up to be what they want to be.
Wow.
How are you going to tell them when they have a penis that
so my daughter the kids were tiny, young, of course, and my daughter is one girl amongst 4 boys, and at one point I was giving her a bath. She looked at me and she said, "Dad," she goes, "when am I going to grow a penis?" That was a child perspective, so maybe they're onto something. So you mean to say that if I were in the Wayback Machine and I were starting over again, that I would have the prerogative of choosing either gender? Is that about it? I got to tell you, Shan, that's not good. I would be one ugly woman. It's just, I cannot. Anyhow, we got to talk about these 10 years. That's what I was at. So for men, it's 12. For women, it's 14. 5 things. Don't use tobacco. Don't abuse alcohol. Exercise on a regular basis. Eat thoughtfully. And the 5th one is maintain a healthy body weight. Now, of those 4 things, we know in intellectual medicine that for a large percentage of patients, maintaining a healthy body weight is not under your control completely. Because for many people, diet and exercise totally fails. And for the majority of folks fighting their weight, it is a medical disorder. It does require physician-guided care in many cases to support the type of nutritional change required that often benefits from prescription drug therapy and the use of nutraceuticals. That's the trilateral approach that we use with such overwhelming success. You know how they put that caveat, individual cases may vary? Well, individual failures are rare when we pursue the intellectual medicine pathway. And Dr. Souza has a skill set, and we are trying hard to spread this message, people. We, along with the AMA, the American Medical Association, which in 2013 declared obesity to be a medical disorder. Dr. George Bray, one of the leaders in weight loss study, described it well, and I'll paraphrase him. Obesity is a metabolic neurotransmitter medical disorder that is discriminated against by society and by doctors themselves. If you ever see a healthcare provider and they tell you to diet and exercise to lose weight, you need another opinion. If you're referred to a nutritionist to lose weight, you need another referral. These pathways have been worn out over the years, decades, and have been shown to be ineffective. And it leads to this perception that the only thing we can do is cut and surgerize. Well, let's tie this together. So those are the big five, right? So let's check the boxes.
They didn't do a study for this, did they?
For what, love?
Those five?
It was in the it was in circulation.
Really?
And they did a meta-analysis looking at different lifestyle factors.
Okay.
They were surprised at the profound impact of these five things. I know it seems like common sense, right? Right? It's like buckle your seatbelt, you're less likely to go through the windshield. But, you know, it's nice to have some of these things kind of validated. But a study, this was from the Journal of the American Medical Association, and what they did is they looked at 122,000 people, this is from the Cleveland Clinic, over more than a decade, people that had cardiac stress testing. So they measured their fitness level, and then they looked at their longevity. And they found that people who were out of shape had a 3-time increased risk of adverse outcome than cigarette smokers. Simply put, they found that being in shape, being conditioned, physiologically conditioned, was the strongest association of health and disease prevention, stronger than any other thing that they have thus measured. It doesn't mean, people, that you can smoke, abuse drugs, and go for a jog and you'll be okay, right? What it means is that the fitness thing seems to really matter. That, in this study anyhow, they didn't find an increased risk with increasing intensity of exercise. Now, we, of course, have a different philosophy. We do feel that there's a diminished return as you push the envelope of intensity, that more is not necessarily better. Now, what they measured was cardiovascular fitness, ability to run, stamina. I'm interested in seeing the studies correlating, and they're out there looking at power, strength, and muscle preservation, because those also correlate. So if you, like us, value vitality and strength, you will make part of your life a regular routine of fitness, because that's been a powerful correlate of life extension, right? 10 plus years. Now, we maintain you add hormones to that mix, and whoa, baby, you got power. You got power in your hands. Now, what should you avoid? Well, you got to be careful with medicine, people. Can I tell you, hospitals are dangerous, and doctors, well, we do a lot of harm. Now, when we come back, I'm going to share with you some key things to avoid when it comes to protecting yourself from the negative consequence of Western medicine. The amplification of drug therapy, the reliance upon surgical remedies for things that are better treated non-surgically. And new information, if you're using an inhaler, you want to stay tuned because of the new information regarding the risk of the inhaler and death from cardiovascular disease. I'll be right back. This is Intellectual Medicine. You're listening to WPRO, the voice of Southern New England.
So, before you're completely done with the headphones,
Yep.
somebody called and then said they were going to be calling back once they're back home with their question, because I guess it was a little complicated.
Okay.
So when they have that question, I'll give you a thumbs up or something, and I'll put it in the studio chat.
Okay, that's perfect.
Computer.
Yeah. Complex questions, we love them. The more complex, the more fun. So the fitness thing, right? What do you like to do for fitness, people? 1 minute. What do you like to do? How do you like to exercise? I don't like to breathe heavy and sweat. Okay? I do it because I like the result. and I have to do things to force myself to exercise because I can't do the whole like treadmill in a gym thing. You love that though, Shan, right? Give me a 5K. Like he hates it.
No, I hate it.
I know.
30 minutes.
30 minutes.
I walk into the gym, look at the time, 30 minutes. I don't
Yeah.
care what I'm doing, 30 minutes. Done.
30 minutes. See, that's a smart thing. Jack LaLanne was once asked at a conference, how do you learn to love exercise? And his answer was, I don't love it. Because I do it because I like the result. I guess like in that manner, like exercise is kind of like saving money. I mean, who really likes saving? I like spending money. But you do it because you like the result or the consequence. Jack LaLanne, God rest his soul, lived into his mid-90s with vigorous lifestyle up until his death. Great role model for many of us, and certainly for those of us who like youthful living. So I do the 1 minute thing.
Back to Intellectual Medicine.
Oh, we're back.
Call in now at 438-WPRO or 1-800-321-WPRO.
We're back. I'm Dr. Petteruti. This is Intellectual Medicine. We are the voice in the wilderness. We are the voice crying out, follow us. We will help keep you young. We are the advocate for the non-medically reimbursed, non-remunerative. We are the people that are helping you separate the wheat from the chaff. You like all these analogies?
No.
You don't like this at all?
No.
Okay, so here's my point. If something is promoted as being the next breakthrough and it's connected to big pharma, be cautious that it's being exaggerated. So we found out this drug, Ilaris, which is an anti-inflammatory drug used to treat certain forms of inflammatory diseases, rare forms of inflammatory diseases, they put into the FDA for an approval to be used to lower the risk of heart attack. The drug Ilaris is an interleukin-1 blocker. Now, we all hear about inflammation often and that inflammation is bad and anti-inflammatories are good. Well, that's simplistic. A super drug that blocks necessary inflammation can be a problem because inflammation, people, is how your body kills infections. So lo and behold, they found out that the drug actually did increase heart attack risk, but it had a slight complication. More people died due to fatal infections. That's not a good swap. And the drug, they're still looking for ways to expand its indications to get it more broadly used. The drug cost, sit down, $200,000 per year for the drug. Can you imagine the pressure on people? Now, let's flip it around. You want to do an anti-inflammatory, do it organically, right? Do it healthfully. Studies have now demonstrated that the omega-3, those much maligned fish oils that orthodox medicine likes to hate, omega-3 fish oil supplements have been correlated with decreased anxiety levels. When we know that the omega-3 is supportive of brain health, now we have growing evidence that it can affect mood and temperament. 1,600 milligrams a day was a dose used in the study, and that seems to correspond. We're finding other studies that have shown some benefit with children and adults with attention deficit disorders. So omega-3 and brain health seem to have a lot of support. It's a nice anti-inflammatory, and it doesn't cause fatal bacterial infections so far as we know. The other drug I need to warn you about, Spiriva, commonly used for people with chronic emphysema. The new onset of Spiriva has been associated with congestive heart failure, angina, and stroke. Not that you should abandon it if you're currently using it. However, these inhaled drugs used for people with chronic lung issues have, in my clinical experience and in studies that I've read, marginal benefit. You want your lungs to work better. Remember, they're part of the whole. See, in Western medicine, we've gotten too much into dividing the body, right? If you have a lung problem, you go see the lung guy. If you've got a headache, you go see the neurology guy. You got a heart problem, the cardiology guy. These divisions, folks, are artificial. Everything connects. If you have a lung problem, remember the lung is driving the organism called your body. And in our approach, we like to increase power, strength, in order to enhance the capacity of the lungs to work, because your muscles are part of that bellows, and get the percent body fat down, which reduces inflammation and physically makes it easier to move your body through space. So be wary of the Spiriva. How about surgery? The only way to avoid surgical risk is to avoid surgery. And unless it's an emergency procedure with death as a consequence, most surgeries are somewhat elective. Nothing more so than knee surgery for torn meniscus. Now, torn meniscus, when I grew up, my association was if you tore the meniscus, it needs to be cut out because it ain't getting better on its own. Now we have yet another study showing that a torn meniscus, whether treated with surgery or with exercise, the outcomes were the same. 1 year after the torn meniscus, whether you had it operated on or did physical therapy and strength training, the same outcome. Now there was a caveat, and that was if your joint locks up. If your joint is locking up on you or it's making you fall because you have an unstable meniscus, that often will require surgery. But if your torn meniscus is causing inflammation, water on the knee, and pain, the evidence does not support surgery to fix that. If you can take heart and be patient and do the exercise piece, joints have a chance to get better. In our practice, the plasma injections have been a powerful benefit. Your body's ability to heal itself is astounding, is perpetual, and to the extent it can be tapped into, is your best remedy for most of what ails you. We just need to figure out the elements to direct. And in the case of plasma, we take your blood, spin it out, separate the red and white cells from the clear part, that's the plasma, where the platelets are now concentrated. Those platelets have growth factors in them, growth factors that make things heal. You inject it into an injured knee, it has power to heal. Same thing, we've seen benefit with shoulders. We've seen regeneration of the face. We do this as part of our plasma facial treatment to keep the face young. Why do we do this? Because you know what? You define health. And many of our patients, I count myself as one, include keeping a youthful face as part of good health. It's not shallow vanity. Been shown to improve mood. 2 studies showing that botulinum treatments for wrinkles enhanced mood. That makes sense. I wonder if I can get Blue Cross to pay for Botox for mood. Diagnosis depression, treatment Botox. I don't think so. Point, you get to make this decision. You get to make it. So that kind of drives me nuts. So here's another one, Shan. Bariatric surgery, headline. If you cut yourself open like a fish and you get surgery for obesity, it's going to reduce your risk of having heart attacks. 20,000 patients had a decrease in myocardial infarction risk after 5 years being monitored for bariatric surgery. All right, but here's your caveat. They were compared to other diabetics who didn't go through any weight loss treatment at all. We maintain the surgery is not the thing. It's the weight loss. And orthodox medicine does not know how to treat obesity unless a doctor has spent significant time independently studying this pathway. And we do this. We have colleagues throughout Rhode Island who do it as well. You can find them. There are not a ton of them, but they're out there. And they are helping people every day lose weight without surgery. Listen, there is a niche for gastric bypass. It should be rare. It should only be done at high volume centers. Because one of the things they found in this study, not this study, but another one, was that the surgical death rate goes up with less experience on the part of the operative team. Now, the surgical death rate was roughly 1 out of 100. Now, extrapolating that to this study on bariatric surgery, I would estimate there to be about 200 deaths from the surgery itself, thus neutralizing the purported benefit. So the surgical risk has to be factored in, right? Did I tell you the story about the bad knee that became a near fatal ICU stay? Right, we're talking about elective surgery for torn meniscus of the knee. Here's a parable. You want another great parable? You need to get my book, The Cancer Machine. If you call my office, you Google it, it's available. It is a wonderful fiction novel, Shen, right? Back me up here.
Wonderful. It's wonderful.
You read it.
Yes,
See,
I
she's
have
totally
read it.
unbiased. It's a wonderful fiction novel that serves as an allegory parable of our times. Imagine what would happen if somebody started speaking about ways to stay healthy. Imagine what would happen if somebody started innovating novel approaches to help prevent cancer relapse, to work toward keeping cancer less likely to occur. Imagine if somebody conceived of a way to remedy the number one metabolic disorder of our time in obesity. Imagine if somebody was pioneering ideas to keep people young. What would happen? Do you think that approach would be welcomed? You realize that diabetes and heart disease is a $200 billion a year industry. How welcomed would it be if we disrupted that and made both of those entities diminish in their prevalence? Do you think that they would champion our cause? Do you think that they would amplify the outcome, our white papers and our results? Read the book and then watch as reality mimics fiction. It's exciting stuff. I love doing this. It's so much fun watching this happen in Chan, seeing people get young and healthy. Bariatric surgery, caution, knee. Oh, so I was going to tell about the knee. So, true story, Shan. Patient of mine had a torn meniscus, went in to get his knee operated on arthroscopic surgery. Right? Routine case, guys like early 50s, totally healthy. Knee becomes infected. Goes back to the operating room where they drain the pus out of his knee. They put him on intravenous antibiotics. He has a reaction to the antibiotics, develops blood clots. They put him on blood thinners for the blood clots. He develops a reaction to the blood clot and gets a pulmonary embolus to both lungs and goes on a ventilators in the intensive care unit for a week. For a week. All that from an elective surgery that the bulk of evidence shows has no value. Holy cow, be careful. If it's an elective procedure, you should get 3 opinions. Surgery can be life-enhancing, life-changing, and sometimes essential. But if you're walking, talking, and feeling okay, you want to get 3 opinions before anybody puts a knife to your skin. Now I'm talking about joint replacement as well. Listen, the boom in joint replacement is being driven by a perception that it's the cure for what ails you. But remember, the body connects and tries to heal itself. Before you replace a hip or a knee or a shoulder, you should do everything else to enhance the entire basis of your health. Power, strength, weight. Right? We told that story, Shannon, of our patient. Came to see us because her surgeon said she had to lose weight before she could get her knees replaced. She was 5'1", weighed 300 pounds. A little over a year later, she had lost over 100 pounds with us. Her knees felt great. She canceled the surgery. It's the last time I ever got a referral from that surgeon. It's not good for business, people. Your health is not good for the medical industry. That is, preserving your good health. It's good for you. I'm not saying that there's a cabal and an evil conspiracy against your good health. I am saying that it's your responsibility to define that. In partnership with your family doc, I love my primary care colleagues. You know, they're in the trenches every day, getting pounded on every side, having their time corroded, having to answer to the computer, to the insurance companies, to the government. You people can answer to nobody but yourselves. You have the freedom to tune into Intellectual Medicine every Saturday morning on WPRO, the intellectual voice of Southern New England, where Shannon and I will regale you with our philosophy, knowledge, and updated studies. Until next time, folks, we are Intellectual Medicine, wishing you 120 youthful years. Hey, gang. Thanks for tuning in. We'll be here every week. I don't know if that question ever came across. I'll see if Tyler did. Have fun this week. Stay on your hormones. And if you're not on them, please, for God's sakes, give us a call so we can start them right away. I'm Dr. Petteruti. We'll see you guys next time. Thanks.